they ask me how do we do the sleeve, how we do bariatric surgery in general. What we do is we rely on certain ports that we call the trocars to introduce our instruments. Can we improve this? Can we improve the cosmetic outcome? Can we improve, can we hide those scars? Can we improve the outcome? Yes, actually we can. We described a new technique in which we actually managed to hide all of your scars. Instead of putting all of your scars right here in your upper belly, we hid all of your scars down below. This is the difference. I wanted to show you on the diagram the difference between the conventional scars and what we described as the bikini sleeve gastrectomy, the bikini line sleeve gastrectomy. The principle is very simple. With the conventional technique, this is the regular sleeve, this is how we've been doing it for the past years. We use 5 trocars right here in your upper abdomen. Right here at center point at your upper abdomen. So they're pretty evident, even though they're really tiny scars. So this is like ½ centimeter. The biggest two are around 1 to 1.5 centimeters. And this is actually where we take out the part of the stomach out. So this is not concerning to a lot of patients because the scars are really tiny, but some patients have really bad healing and they tend to form extra scarring. So this can tend to be ugly. I'll show you later in the video some pictures of different scarring of different patients with the conventional technique as compared to our technique. So this is the regular sleeve. How about our new idea? Our new idea, we developed this idea over the past year. We've been doing it for over a year now. And the idea is very simple. Your stomach lies up here, so that's why we put all of the scars near your stomach. So this is the conventional way of doing it. You have 5 scars, around 5 scars, right here at the top of your belly. We thought of a new idea. We thought of doing it different. We wanted to hide all of your scars. So what we did is, instead of putting all of your scars up here, we went down below the bikini line. That's why we called it the Bikini Line Sleeve Gastrectomy. We place 3 scars down here, and through which we can complete the operation. We specially designed some instruments, obviously to reach the stomach over here. And sometimes, if necessary, we place another trocar. We hide it in your belly button, because the belly button is a natural scar anyways. So we use that to hide one of your scars, through which we can introduce our different instruments that we use. The end result is that if you're wearing a bikini down here, nothing would be showing that you had any surgery before. Even a bariatric surgery would not know that you had surgery before. And this can be interesting for some people who are really concerned about scarring, who have bad history of scarring, young ladies, people who don't want anyone to know that they had the surgery before. And actually, one of my patients told me that she was, I always say that example, that she was a month out after the surgery, and she was in the locker room changing, and even though she was open about the surgery and was telling all of her friends, but in the locker room with strangers around, she didn't want anyone to know, and she felt very confident that no one noticed, and she was happy. And actually, she texted me back while she was in the locker room, and she told me, I just changed my clothes, nobody noticed a thing. And she was a month out. If she had the conventional scars, these scars, especially during the early period, would be very showing, and anyone would notice the scar, obviously. In the next segment, I'll show you a couple of pictures. So those pictures that you can see now are for patients that had the conventional sleeve. You can see people heal differently, and as you can see, some of them are acceptable, others are really bad and ugly. So for people who are really concerned, in the following pictures, as you can see, those are the Bikini Line Sleeve Gastrectomy. So this patient is just 10 days out. Can you imagine? This patient had a sleeve gastrectomy. In the following picture, this is a patient who had a sleeve 6 months ago, and as you can see, she lost a lot of weight. And in the following patient, this one is 1 year out. As you can see, she lost a considerable amount of weight. All the weight is off, and there are no scars. I had to ask the patient to lift her belly in order that you can see her scars, and as you can see, it's barely noticeable. So after you've seen that, we believe that putting your scars down below tend to heal better. So if you had scarring bad at the upper belly, you probably have better healing at the lower belly. The reason for that is that the lower belly has no tension on it, and tension is really bad for healing. So this upper belly, imagine a lot of fat here is pulling down with gravity. So it's pulling down against healing. So two forces against each other. This results in the bad healing. If we place it down here, there's no tension. Therefore, we would expect that lower scars heal better than upper scars. We're studying that. We feel that lower belly scars are less painful than upper belly scars. We're still researching that, but a lot of patients have told us that it's really not painless. They're up and about in a day, 24 hours, they're out of the hospital, and they're doing their regular daily tasks. I hope this video was informative enough. Please feel free to ask any further questions. Leave your comments below, and we'll answer all of your questions. Thank you. This is our innovation. We've been doing it under the context of research over the past 1 year, and we are glad to announce that it has been accepted in one of the biggest medical journals, surgical journals in the specialty of obesity surgery, and it has been presented at one of the biggest international congress, the 22nd International Congress in London, just past week. And we're pretty optimistic about the results. Results are really promising. So this new technique we offer to certain, not to all patients. You have to be eligible for this technique. Obviously, not everyone is eligible. So please don't forget to ask if you're eligible for this technique or not.